Hello, this is a brief training video to introduce you to two SBIRT tools, the Patient Health Survey and Clinical Documentation. Let's start with the Patient Health Survey. When a patient arrives for the first time or for a complete physical exam, he or she completes the Patient Health Survey, which includes questions about mental health and substance use. The medical assistant gives the iPad tablet to the patient in the exam room and explains the purpose of the questions. If the patient has any difficulty with the tablet, the medical assistant offers help. Once the patient completes the survey, the medical assistant retrieves the tablet and calculates the score. He or she then documents the scores in the medical record and informs the clinician. Let's go through the survey to demonstrate how it works. I am using a computer, which means I will answer the questions by clicking on them, but patients will answer the questions by tapping. The first screen explains the purpose of the survey and shows a large red button. Let's click on it to continue. You can see every question at the top in a large red rectangle. Possible answers are below. In the bottom right-hand corner, you see a progress meter, which tells the patient how much of the survey is completed. The survey includes 3 questionnaires, the PHQ-9, the audit, and the DAST. There is also a single question about tobacco use. The tablet determines if a patient needs to complete the entire questionnaire. For example, if I click on the first answer here, which is not at all, then my PHQ-9 score is 0, and I go to the next question. If I click on not at all again, then my score remains 0, and the tablet determines I do not need to answer the rest of the PHQ-9 questions. This saves time for everyone. However, if I choose one of the other 3 options, then the tablet determines that I may be at risk for depression and lets me continue answering the rest of the questions. For now, I will click on Not at all. After the PHQ-9 is a question about tobacco use. Let's click Yes here. You can see how much progress we've made so far. You can also see the color of the survey change. Now I can answer a question about my use of alcohol. The color for this questionnaire is blue. This is a pre-screened question, which means if I choose no here, then I don't have to answer the rest of the questions. Let's choose no for now. Okay, now I can answer questions about drug use. This is also a pre-screened question. Let's answer yes here for the sake of practice. Now I will answer the rest of the questions for drug use. This brings me to the last screen for the patient, which includes a thank you message and instructions to return the tablet. At this point, the medical assistant can continue to the next screen by clicking on the large red rectangle here. Now we can calculate the score by clicking on the large red rectangle again. Only click on it once, or else you'll double or triple the scores. We now have scores for each of the 3 questionnaires. At the bottom, we also have notifications for tobacco use, suicidal ideation, and prescription drug abuse. All of this data should be entered into the medical record. I am done with the survey, so I will refresh the page for the next patient by clicking up here. You can do this at any time with the survey. The survey tool does not send data to the medical record. The medical assistant must enter it. It's now time to show how to document the scores. I already have a test patient set up right here. Open up a V8 document. And then click on Toolkit on the left side panel bar. Click on the Screening tab in the middle here. Here you can see areas to enter the survey scores, information about drug use, and the type of brief intervention used with the patient. For me, I completed the PHQ-9. My total score was 0. I also completed the audit, and my total score was 0. I completed the DAST, and my total score here was 10. I did flag positive for prescription drug misuse and tobacco use. Here, the clinician will enter information he or she gathered while reviewing the scores for the patient. For example, a patient may say he drinks 3 to 4 beers each night, or uses amphetamine at parties every weekend. All that information should be entered here. Finally, the clinician indicates which brief intervention he or she used. If she gave feedback, then click here. If she did the decisional balance and the importance ruler interventions, then click here and here. Now I have helpful information about my substance use in my medical record, which the medical team can follow up on at subsequent visits. The Patient Health Survey and the medical record document are important tools for helping patients with substance use problems. This concludes the training video.